Welcome to Silver Wisdom, practical advice for health, life, and well-being after 60. Let's grow wiser together. You might not hear this during your typical doctor's appointment, but let me be straightforward. If you have stopped masturbating in your later years, your body could already be deteriorating, and you may not even realize it. This is not some taboo subject or locker room myth. It is a genuine clinical and physiological fact. Ignoring this reality can lead to severe consequences, affecting not only your sexual health, but also your brain, heart, sleep quality, immune system, and even your sense of identity. My name is Dr. Michael Carter. I'm a urologist and specialist in men's health. With more than 30 years of experience treating aging patients nationwide, I have dedicated my career to studying how the body changes with age, especially regarding intimacy, hormones, and long-term vitality. One of the most overlooked dangers I have encountered is this. Many older adults give up on their sexual health, inadvertently losing a crucial element of their overall well-being. Here is something that may surprise you. Masturbation is not just a leftover urge from youth. It remains one of the most effective tools your aging body possesses for regulating hormones, enhancing brain function, protecting the prostate, and even combating depression. If you have stopped or never began, the cost might be far greater than you imagine. In the next few minutes, I will explain in detail what is happening inside your body. What happens to your body when you stop masturbating in old age? And what I'm about to share might completely transform the way you view your health and yourself from this point onward. Before we dive in, if you are interested in maintaining mental clarity, physical well-being, and independence as you grow older, make sure to subscribe and activate the notification bell so you never miss essential tips tailored specifically for you. If this topic strikes a chord with you, type 1 in the comments. Otherwise, type 0. Your input allows me to craft content that genuinely supports your health and wellness. Now, let us explore the first and possibly most overlooked impact of ceasing masturbation in later years, how it subtly affects your prostate and urinary health. One major change involves a decline in prostate wellness and urinary function. When I started practicing urology more than 30 years ago, I was surprised at how many patients openly discussed such a private, yet vital part of their well-being: the fading away of sexual activity in their senior years. I recall one gentleman in his early 70s who was fit and alert, but had been waking up several times nightly to urinate, confused about the cause. What he did not know, and what many men fail to understand, is that consistent ejaculation, even if only through masturbation, plays an essential role in maintaining the proper function of the prostate gland. The prostate is far from being a passive gland resting quietly inside the body. It is an active and lively organ. It produces fluid, expands, contracts, and just like any other system, it suffers if ignored. Without regular stimulation and release, prostate fluid can become stagnant. This stagnation creates an ideal setting for inflammation, swelling, and eventually pressure that interferes with functions such as urination and sexual performance. You might notice symptoms like a feeling of a heavier bladder, a weaker urine flow, or a persistent fullness that does not disappear. These are not mere irritations, but early signs of trouble. The concerning part is that ongoing prostate congestion can slowly develop into more severe problems like benign prostatic hyperplasia, or BPH, which impacts almost half of men past the age of 60. If left untreated, this condition can result in urinary retention, bladder infections, or even require catheter use. The same man I mentioned earlier ultimately needed surgery to ease this pressure, something that could have been prevented through simple, consistent routines started sooner. Regular ejaculation plays a crucial role in maintaining prostate health by flushing out the gland, clearing old fluid, and lowering the chances of fluid buildup. Research indicates that men who ejaculate at least 21 times each month have a considerably lower probability of developing prostate cancer compared to those who do not. It is important to understand that this advice is not about returning to youthful habits or engaging in excessive behavior. This is about practical function, focusing on the organ's well-being rather than fantasies or unrealistic goals. Using your own biology to safeguard your body in the simplest and most natural manner possible brings remarkable benefits. When you stop self-stimulation during later years, you're not just foregoing pleasure, but also inviting discomfort, inflammation, and a slow deterioration of control over a fundamental human function: urination. I've encountered patients who became too fearful to leave their homes because they no longer trusted their bladder. I have witnessed strong, dignified men reduced to sleepless nights and anxious days caused by a condition that might have been prevented or managed by something as straightforward as regular self-stimulation. There's also a psychological burden in losing command over your own body, having to plan every bathroom visit, fearing long trips in the car, waking every 2 hours after midnight. It gnaws at your sense of independence. This issue is not solely about the prostate. It strikes at your freedom. What happens next is even more astonishing because what begins in the prostate does not remain confined there. The next impact stretches beyond the physical, reaching your brain, and once it sets in, it can change the way you think, feel, and recall events, sometimes in ways that prove very hard to reverse. Let us explore what occurs to your mental sharpness and cognitive abilities when self-stimulation is removed from your routine. If you are still reading and these insights speak to you, type the word 1 in the comments to show that you are still here, still attentive, and still valuing this message. Now let us move on to the second point. Cognitive fog and a decline in mental sharpness are common concerns. Not long ago, a man in his late 60s visited me. He was not worried about his prostate or his energy, but said something that caught my attention. He told me, "Doctor, I don't feel like myself anymore. I enter a room and forget why I came. I lose my train of thought in the middle of a sentence. I used to be so sharp. Is this just aging?" This question arises more often than you might expect. Indeed, getting older naturally affects brain function, but many people, even well-informed health-conscious individuals, are unaware that sexual activity, including masturbation, significantly influences brain health. Here is what occurs when you engage in self-pleasure. Your brain releases a mixture of neurochemicals such as dopamine, serotonin, and oxytocin. All of these are closely connected to memory, focus, and emotional balance. These chemicals do more than create momentary pleasure. They work to strengthen and safeguard neural pathways. They increase blood circulation in the brain and lower cortisol levels, the stress hormone which in excess can harm brain cells. However, when masturbation stops, especially for extended periods, these beneficial chemical releases happen less often over time. This can dull your mental clarity. You might struggle more with focusing, processing information, or even finding motivation. This change is gradual. Initially, you might forget names, then gradually experience deeper cognitive challenges. When you lose track of the day, you may begin to completely question your own mind. And within that uncertainty, something more troubling can take hold. Fear. I have witnessed individuals descend into anxiety and depression merely because they believed they were losing their mental sharpness, while in fact their brains were deprived of stimulation and chemical balance. For men, there is an additional hormonal change. Testosterone, a hormone closely linked to memory, decisiveness, and energy, can decline more rapidly when sexual activity falls to almost nothing. Testosterone is not merely about sexual desire. It involves your identity, your strength, your mental clarity, and all. Regular, healthy ejaculation can actually help maintain and regulate testosterone levels as you age. Some research even suggests that reduced sexual activity among older adults may be connected to early signs of cognitive decline or dementia. I'm not suggesting that stopping masturbation leads to Alzheimer's, but what I am saying is that when the brain lacks stimulation, emotional release, and hormonal support, it becomes more vulnerable. It loses its rhythm and resilience, and for many people, the mental fog thickens enough to alter how they live, interact, think, and perceive themselves. One man shared that he stopped attending his chess club because he could no longer concentrate on the game. Another retired teacher explained he felt empty every morning. These were not memory issues needing medication. Rather, they were signs of a life separated from physical intimacy. Taking care of oneself is crucial, and here lies the heartbreaking truth: these struggles can be prevented. You do not always require costly medications or therapies. Often it begins by reconnecting with your own body and giving it the gentle attention it silently desires. When you activate the body, you also awaken the mind. However, this decline in mental clarity is only part of the story. What follows when emotional stability begins to crumble and your mood starts to fluctuate unexpectedly can be even more subtle, more harmful, and tougher to discuss. Let us delve into how abandoning self-intimacy can quietly invite depression to take hold of your everyday life. I remember a case involving a man in his early 70s named Michael Carter. He was a widower, retired, and generally healthy. But he came to me not for a physical issue, but for something he struggled to describe: Looking me directly in the eyes, he said, "I do not feel anything anymore. Not sadness nor happiness, just numb." After a brief pause, he asked, "Is this normal for someone my age?" That question stays with me because I often hear similar concerns. Many people think this dullness, disconnection, and gradual emotional decline is simply part of getting older. Yet, it usually stems from a deeper, more physical cause that is rarely addressed openly: the loss of sexual stimulation, especially self-pleasure. Here is an important fact. When you stop physically engaging with your own body in an intimate way, your emotional world can begin to change in quiet but significant manners. Masturbation is not merely a physical act, but a vital connection to oneself that influences mood and emotional health profoundly. Masturbation is not merely a physical activity, it serves as a crucial emotional outlet and functions as the body's natural mechanism for easing stress. During orgasm, the brain emits potent substances such as oxytocin and endorphins, which act as natural stabilizers for mood, helping to alleviate feelings of anxiety, tension, and sadness. Removing this emotional release from your routine, especially in times marked by stress, loneliness, or grief, can lead to emotional numbness that might gradually transform into something much more serious: depression. I have witnessed this progression firsthand when someone ceases to masturbate following the loss of a partner or due to the belief that it is no longer suitable for their age. As weeks turn into months, they become increasingly silent, withdrawn, lose enthusiasm for their hobbies and social interactions, their sleep patterns shift either into excess or deficiency, and their appetite fluctuates. Life begins to lose its color. The unfortunate truth is many remain unaware of this link, mistakenly blaming themselves or accepting this state as the new normal. What they are truly lacking is the fundamental act of staying connected with their own body, not solely for pleasure, but as a means of emotional preservation. In older adults, depression often goes unnoticed because it may not present as sadness, but rather through exhaustion, irritability, detachment, or lack of motivation and desire. While therapy and medication play vital roles, I have helped countless patients find relief simply by guiding them to reconnect with their physical selves. Self-intimacy is a topic that often goes unspoken. Yet one man shared with me that after he started touching himself regularly for the first time in many years, he felt truly alive again. He said this habit not only improved his mood, but also reminded him that he was still a living, feeling person. He was not simply a body waiting to break down. That simple act restored a part of himself he believed was lost forever. This is the key message I want you to grasp. Masturbation later in life is not about fantasy, desire, or guilt. Instead, it is about maintaining your emotional well-being. It provides your body with a reason to experience sensation, to let go, and to reconnect with the present moment. When you lose this connection, you risk more than just sadness. You put yourself in danger of loneliness, emotional decline, and sometimes even lose the motivation to participate in life. The impact on emotions is not the only issue. As the nights stretch longer and your sleep becomes more fragmented, another unseen problem starts to increase. It can harm your memory, weaken your immune defenses, and raise your chances of developing serious illnesses. Next, we will explore how the lack of sexual release might be robbing you of the deep, restorative sleep your body urgently requires. If you are still watching and find this information valuable, please type the number 1 in the comments below to show you are engaged and following along. Now let us continue to point number 4, which focuses on declining sleep quality. I recall a man in his late 60s who approached me after months of restless nights. He appeared exhausted, pale, and visibly irritated. The doctor mentioned that I fall asleep but then awaken at 2 o'clock in the morning as if launched from a cannon, and afterward I just lie there staring at the ceiling waiting for daylight. We performed various tests. His laboratory results were clear, showing no signs of apnea or any significant warning signs. However, when I carefully inquired about his intimate life, he averted his gaze and said, "That part of me is over." Yet that part of him, the aspect he believed had ended, might actually be the crucial element his body desperately needed for restorative and uninterrupted rest. Sleep involves far more than simply closing your eyes and remaining still. It is a complex hormonal process, and one of the most powerful natural triggers for deep sleep is something many overlook. After reaching a certain age, during orgasmic climax, the body releases oxytocin, prolactin, and endorphins, creating a perfect chemical blend crafted by nature to shift the nervous system from a state of stress to one of relaxation. Simultaneously, cortisol, the hormone linked to anxiety and alertness, drops significantly, Your breathing slows down, your heart rate becomes steady, your muscles ease, and you enter an optimal condition for deep sleep. Now imagine eliminating that process completely from your life. Not just once, but for weeks, months, or even years. This is what occurs when older adults cease to masturbate. The body loses a natural mechanism it had previously depended on. What often replaces this loss is restlessness, irritation, frequent tossing and turning. Some turn to sleep medication, while others simply accept fatigue as their new reality. However, the consequences of poor sleep quality can be far-reaching. Sleep impacts far more than mere fatigue. Long-term lack of rest undermines the immune defenses, speeds up mental decline, raises the chances of heart conditions, and heightens susceptibility to anxiety and depression. In older individuals, sleep issues often lead to falls, memory problems, and diminished autonomy. I have encountered patients who were once lively and socially active but gradually withdrew. Not due to any serious illness, but simply because exhaustion made it impossible to keep up. What concerns me most is that many were unaware they had lost the very natural mechanism that once helped them sleep. This mechanism is not a medication or supplement, but the body's own built-in release valve. Masturbation might appear minor or inconsequential, yet for some, it can mean the difference between restless, interrupted sleep lasting about 4 hours and peaceful, restorative rest nearing 7 hours. One patient shared after reconnecting with this part of himself, "I sleep like I did 3 decades ago. I never realized how much I needed that release. I thought it was just aging." This misunderstanding is widespread. Many confuse biological neglect with growing old and resign themselves to suffering quietly. If you find yourself awake at night with racing thoughts, tense muscles, and dragging hours, ask when your body last truly relaxed and let go. Often, the answer is not a new pill or a meditation app, but rediscovering an ancient rhythm your body still recognizes if you allow it. Although sleep deprivation can silently drain your energy and cloud your mental focus, the next effect we will examine is more physical and becomes evident in how your muscles grow weaker, your balance alters, and your bladder begins to fail you. Let us discuss what genuinely occurs to your pelvic floor and circulation when intimacy fades away. Several years ago, I cared for a retired firefighter in his 70s, a man proud of his physical strength throughout most of his life. He approached me with complaints of mild urinary leakage and trouble standing for extended periods due to discomfort in his lower back and hips. "It feels strange," he expressed, "as if the foundation of my body is gradually giving in." What he described was not just normal aging, but the gradual, almost unnoticed weakening of his pelvic floor. And he was not alone. The pelvic floor consists of muscles located at the base of your core, those that support your bladder, bowel, and sexual organs. Usually people do not consider these muscles until problems arise such as urine leakage, constipation, erectile dysfunction, or pain while standing or walking. What is frequently overlooked is that consistent sexual activity, including masturbation, plays a vital role in keeping these muscles active and engaged. During arousal and orgasm, the pelvic floor contracts in a rhythmic manner. This contraction serves as an exercise, not for appearance but for essential functionality. Improving circulation to the lower body enhances the strength of the internal support system and maintains effective communication between nerves and muscles. It is not about performance, but about preservation. When you cease regular masturbation, those muscles do not simply become inactive. Instead, they begin to weaken. Blood flow diminishes, tissues lose elasticity, nerve reactions slow down, and eventually, you might experience unexpected symptoms. These can include frequent urges to urinate, mild dribbling after using the restroom, difficulty controlling gas, or even pain when moving. For men, this may result in a significant decline in sexual function. For women, it might cause dryness, tension, and discomfort that discourages any form of intimacy. Michael Carter has witnessed formerly independent adults start to skip social gatherings simply because they do not trust their bladder. He has also observed others feeling ashamed of sudden leaks when coughing or sneezing, unaware that everything traces back to long-term neglect. Circulation and muscle function in the pelvic region are crucial. Ignoring this area is not only inconvenient but can lead to falls, incontinence, and the loss of dignity that nobody deserves. People may begin to depend on pads, special underwear, or constantly plan around bathroom locations, all because the foundation of their body lacks the necessary stimulation and support. The longer this issue persists, the harder it becomes to reverse the damage. What truly saddens Michael Carter is the number of individuals who suffer silently due to this often overlooked problem. Many individuals endure their struggles quietly, unwilling to discuss them openly because they feel embarrassed, uncertain, or believe such issues are simply a natural part of aging. However, it is crucial to understand that even at 70, 80, or beyond, the body still desires to function well. One of the most powerful natural ways to support bodily health without relying on drugs or devices is through consistent, safe, intimate stimulation. Re-establishing this connection is far more than experiencing pleasure. It helps rebuild strength, increases blood flow to essential areas, revitalizes nerves, preserves tissue vitality, and reassures the lower body of its ongoing importance. Beyond these physical effects, the benefits extend much deeper within the immune system, affecting cellular defenses and the body's capacity to fight illnesses. What happens in the bloodstream after climax might represent one of the most vital, yet frequently ignored, health advantages of all. Let's consider how a lack of sexual activity could quietly undermine immunity over time. Several winters ago, Michael Carter, a patient in his late 60s who had generally enjoyed good health, came to me looking exhausted. He had suffered from 3 bouts of illness during that season, each time battling prolonged colds and mild infections. "I used to recover within a day or two," he said, "but now every minor illness takes me out for weeks." After eliminating common causes such as diet, sleep, and medication, I carefully inquired about another aspect of his life. "Have you?" He had not been sexually active at all, not even by himself. He gave an uneasy smile and then shook his head. "No, not for a long time. That part of me is simply retired." What he did not realize, and what many people overlook, is that sexual activity, including masturbation, has a direct effect on the immune system. This is not just a figure of speech. It is biology. During sexual excitement, and especially at orgasm, the body releases a flood of biochemicals. These are not only dopamine and oxytocin, which elevate mood, but also immune-boosting substances. For instance, immunoglobulin A, known as IgA, increases significantly. This particular antibody plays a crucial role in protecting the body against viruses, bacteria, and infections, especially in the respiratory and digestive tracts. Additionally, endorphins are released which help reduce inflammation and promote healing. Now imagine missing out on this natural benefit, not just for a few days, but for many months or even years. The body begins to lose one of its simplest and most natural lines of defense at a stage of life when the immune system is already decelerating. Removing this support is like taking the batteries out of a smoke alarm. You might not immediately notice the absence, but when health issues arise, your body will not react as it once did. I have witnessed this firsthand in patients who have stopped their intimate lives. They tend to get sick more often, take longer to recover, or deal with worsening symptoms of chronic inflammation. Although they may not realize the connection, their bodies are clearly signaling that something is wrong. The immune system is not only essential for fighting off common illnesses like the flu, but also plays a vital role in long-term disease prevention. It supports cancer monitoring, safeguards cardiovascular health, and aids in wound recovery. Regular sexual activity contributes to maintaining hormonal equilibrium, lowers stress hormones such as cortisol, and improves blood flow, all of which are vital for sustaining immunity. When this disappears, a chain reaction unfolds. Stress levels rise, sleep quality decreases, inflammation intensifies, and the body becomes a diminished version of its former self. One woman in her 70s, after losing her husband, confided that she had not engaged in self-pleasure for nearly 5 years. When we discussed the honest link between sexual life and immune strength, she chose to reconnect with that aspect not driven by desire but for her health. Months later, she came back with a renewed glow and increased vitality. "I cannot explain it," she said, "but I simply feel more alive, like my body is cooperating with me instead of working against me." This transformation is not mystical. It happens because the body receives signals that say, "We are still active. We want to flourish." Although it can be easy to ignore, feel uneasy about, or dismiss, the immune system does not respond to shame. It reacts to action. Sexual stimulation, even when alone, is a potent act that conveys the message of life and vitality to every cell within the body. While weakened immunity may increase vulnerability, neglecting self-intimacy can ultimately affect you more deeply than you might expect, potentially eroding your very sense of who you are. When you stop feeling the connection with your own body, you may gradually lose touch with your identity. Let us examine how ignoring this important aspect can silently diminish your self-esteem and what steps you can take to restore it. Severe loss of body ownership and self-worth is something I recall vividly from a quiet discussion with a patient in his late 70s. Michael Carter was a retired school principal, once full of confidence and sharp wit, the kind of man who naturally commanded any room he entered. However, during a routine health check, his posture had notably changed. His shoulders slightly slumped and his eyes lacked their usual spark. As we spoke, he sighed and shared, "I don't really feel like I live in this body anymore. I feel like I'm just inhabiting it." Those words stayed with me because his experience is far from rare. I have heard similar sentiments expressed by both men and women differently, but with the same core truth. At some point, they stopped feeling comfortable in their own skin. Frequently, this disconnection begins quietly with silence, dismissing self-touch as unnecessary, something only for younger times or a phase left behind. But the truth is far more profound. When you cease to touch your body or engage with it in a meaningful, intimate way, you start to drift apart from it gradually, silently, and sometimes irreversibly. Self-touch goes beyond just physical pleasure. It fosters presence and awareness even with the gentlest stimulation. Without any aim apart from reconnecting with yourself, you remind your nervous system that you continue to exist, that you are important, that your body remains a part of who you are, not just a container waiting to be left behind. When this is missing, something shifts. An emotional and mental gap appears, making it simpler to overlook minor pains, easier to avoid your reflection, and tempting to believe this phase of life is not worth tending to. This represents the most perilous loss of all, the loss of your own value. I have witnessed this detachment lead to profound emotional numbness, embarrassment about growing older, withdrawal from physical touch, and even a decline in motivation for essential self-care. People stop exercising, eating well, or dressing with care. Why bother, they wonder, when this body no longer feels like mine? One woman shared that she had not touched herself since menopause, saying, "I just stopped feeling like a woman, and the less I touched myself, the more I disappeared." The word disappeared struck me deeply because that is exactly what occurs for many older adults who cease connecting with their physical being. They lose not only pleasure, but also identity, visibility, and a sense of vitality. Now, here is what I need you to understand. It does not have to unfold this way. Reclaiming your body through gentle touch is not about being sexual as you were at 20. It is about honoring the life still within you. It is about declaring, "I am still here. I still feel. I still matter." You deserve to be seen even by yourself. When you reconnect with your body, even in the solitude of your own space, you start to undo that silent erasure of who you are. You remind yourself that growing older does not mean disappearing, that your value did not vanish with your youth. You find your way back to yourself, and perhaps that is the most restorative thing of all. Now, as we reach the conclusion of this journey, let's bring everything together, because while each of these 7 effects is significant on its own, together they reveal a much deeper and more urgent reality. In the final message, I want to show you what is truly at risk and, even more importantly, how you can regain control, starting right now. Reflecting on the years I've devoted to caring for older patients, what stands out to me is not just the medical obstacles they encounter, but the quiet, unseen losses they endure. These losses do not appear in test results or scans. A man who once carried confidence now shies away from his reflection. A woman who used to glow with happiness now feels numb in her own body, and often hears that this is simply what aging looks like. But I refuse to accept that, not for a moment. And if you have stayed with me until now, I doubt you believe it either. The reality is that the instant you stop nurturing your sexual self, the instant you abandon that part of your body and identity, a chain reaction of subtle consequences begins. We have explored these step by step together. First of all, consider how prostate and urinary health can deteriorate when regular release is absent. The brain becomes clouded and less sharp when it lacks stimulation. The lack of physical closeness can lead to depression, disturbed sleep, reduced blood flow, and even weaken the immune system. Perhaps most painfully, abandoning that intimate and personal connection with your own body can slowly erode your self-worth until you feel like a stranger to yourself. These issues are significant. They are not simply part of aging. Instead, they are signals from your body, mind, and spirit asking for your attention. I have sat with patients who felt shattered, detached, and numb. I witnessed the shift in their eyes as they began to reclaim this aspect of their lives. It does not require anyone else. It does not need youth or perfect health. All it takes is your permission to recognize yourself as deserving of intimacy, especially now. I understand this topic makes many uncomfortable. Some feel ashamed. Others were never taught that caring about sexual health is acceptable past a certain age. But let me tell you, as a doctor who has guided thousands of men and women through this journey, it is not just acceptable, it is vital. Masturbation in later years is not about indulgence. It supports circulation, mental clarity, hormonal balance, emotional stability, immune strength, and self-identity. It is not a luxury. It is a form of self-care that every person deserves at every stage of life. Taking care of yourself is a way to affirm that you are still present in this body and accountable for its well-being. One individual once shared with me, "I did not realize how much I longed to feel like myself until I finally connected with that part of me again. This is what it truly means, not merely existing, but genuinely feeling alive. Not simply enduring the years, but living them fully with awareness, honor, and happiness. If you have forgotten this aspect of yourself, hidden it away, or judged it, I encourage you now to reconsider, to re-establish that connection, and to remember that your body is still attentive, still capable, and still worthy. Begin gently, with curiosity and compassion. But above all, begin. By choosing to nurture this side of yourself once more, you're not only safeguarding your health, but also reclaiming your life. If this message has touched you, please do not keep it to yourself. Like this video, share it with someone who might need to hear it, and leave a comment below to share your thoughts. Whether you agree, disagree, or have questions, your voice is important, and your story might help someone else feel understood.